It's my pleasure to introduce Dr. Robert V. Walker, a medical researcher and doctor of oral surgery at Parkland Memorial Hospital. In 1963, Walker was briefly inside the Trauma Room 1 as an observer during the treatment of President Kennedy. So let's all give a big round of applause to Dr. Walker.
All right. Well, I want to introduce myself. I'll be moderating the discussion today. My name is Stephen Fagin. I'm the oral historian here at the Sixth Floor Museum at Dealey Plaza, and we're very thrilled that you guys could be here with us this morning. How many of you, prior to visiting the museum today, have been to the sixth floor before? All right, so just a couple of you. Well, welcome. I know you guys have been here for about 2 hours today, so you all should be experts on the Kennedy assassination. Am I right? Yeah, for the most part? Good, good. Well, what we're going to do today, you're going to get a glimpse inside what my job is at the museum as oral historian. What I do is supervise an ongoing oral history project, and what that means is I go out into the community and I record videotaped interviews with individuals who remember where they were when President Kennedy was shot. We talk to people about President Kennedy's life, his assassination, the impact of his assassination, and also just the general history of the Dallas community and the 1960s. It's a very, very broad project, and we've done over 650 of these videotaped interviews since we started it when the museum first opened back in 1989. I've been here over the last 9 years working on this project. And so what you're going to get to see today is what we call a living history program. And you're going to basically be able to see an oral history as it takes place. I'm going to engage our speaker in conversation. We're going to look at a few pictures. But then after we've talked for a little while, you guys are going to have the chance to become oral historians yourselves, and you're going to get to ask questions of our speaker. And if you look behind you at the camera that's up on the tripod there, that's the exact same camera that I use when I go out and do these oral history interviews. And so this interview, like the ones I do one-on-one, this program is being recorded for our archives. And so if you get to ask a question today, you'll permanently be in the oral history collection of the Sixth Floor Museum. So you guys will get to be oral historians if you ask a question. Now, that said, as we do our discussion, as we do our program today, try to think about questions that will be relevant maybe 50 or 100 years from now when most of us are gone. Think about questions that will be important to future students and teachers and researchers and historians. So, for example, our speaker today was at Parkland Hospital and was there when the president was treated and when he died. So asking him about the shooting of Lee Harvey Oswald or something like that wouldn't be appropriate because that's not the part of the story he was involved in. So try to think about specific questions related to this individual's role in the assassination story. That's the role of historians, and that's the role that we're all going to play today as we have this living history program. So with that, we're going to get started. As our introducer said, this is Dr. Robert V. Walker. He is a professor emeritus at UT Southwestern Medical School. And back in 1963, you were at Parkland Memorial Hospital the day of the assassination.
That's correct, I was.
Why don't we start by giving us just a little background about Parkland back in 1963 and what work you were doing there.
I'll start a little bit before then to come up to 1963.
It's your program.
I'm an oral and maxillofacial surgeon, a dentist, and I treat wounds about the face, the upper jaw, the lower jaw, the frontal area, parts of this nature. And Parkland Hospital is the largest receiving hospital in this whole area. We get a lot of injuries and a lot of gunshot wounds, so it wasn't unusual that Kennedy was brought to Parkland Hospital with a gunshot wound. I began as a resident at Parkland in 1954 because of expertise I had gained during the Korean War in the early 1950s. 1/3 of the casualties who had been shot in the face or jaws were sent from Korea to Brooke Army Medical Center in San Antonio, where I was stationed. So I really gained a lot of experience on our soldiers who were injured during a war. But I didn't have the credentials to be an oral surgeon. I came to Parkland for 2 years of residency in 1954, and I was very far ahead of everyone in treating these wounds in those days. I was asked to join the faculty in the Department of Surgery July 1, 1956. So I had been on the faculty 7 years in 1963. My career started in Army shacks, as we were a very young school. in those days. And Parkland Hospital was located on the corner of Maple Avenue and Oak Lawn, an old hospital. We desperately needed a new hospital. So a new hospital was built and created and opened in 1954. We did not, so my career started partially in the old hospital, and then we moved to the new hospital. I was appointed to the faculty, as I said, in 1956. We were in the new hospital at that time. I was the only faculty member in my division, so I had to work hard to cover the many responsibilities given me. So yes, I was in the hospital on the day that Kennedy was shot. We were just a routine day so far as we were concerned. None of us that were engaged in an active role in the hospital had plans to go to the luncheon where Kennedy was to speak. And so I had a usual morning in surgery, had a good friend who was the chief of anesthesia, Dr. M.T. Pepper Jenkins, and the operating room supervisor, Audrey Bell. We were good friends, so after surgery we simply went down to lunch and then engage our afternoon activities after that. So it was maybe to this point. Do you want me to carry it further? Or?
Yeah, why don't we'll take a look at our first picture here. These are some very rare color photographs taken at Parkland Hospital in the years following the assassination, but it'll give you a glimpse as to what the hospital looked like and the areas of the hospital we're going to be talking about where the president was treated. This is part of the emergency room, correct?
That's correct, yes.
This is the hallway, and this room here is the room where President Kennedy was taken and where President Kennedy died, trauma room number 1. But we're going to start your part of the story. You were actually having lunch at the time, right?
That's correct. It's, you know, a nice social engagement, and consisted of lunch and conversation. And during lunch, there was a repeated emergency call, and emergency call has the term of stat, means to answer it now. There's a stat call for Dr. Tom Shires. Dr. Shires was the chief of surgery. And you have to understand the makeup of a big teaching hospital. Below the chief of surgery, there are many residents that are under his stewardship in terms of learning surgery and the intellectual part of care of patients. So rarely did you ever hear Dr. Tom Shires' stat. It was one of the residents that was usually paged. We thought that was very unusual. One of the residents in surgery, Dr. Ron Jones, happened to be having lunch at the same time. He went to a phone on the wall to answer the stat page. And let me explain to you now. In those days, we didn't have beepers or cell telephones on our waist. The way of communication among personnel in the hospital was through a speaker system. So there were speaker boxes in the hallway, in the cafeteria, in the lounges, on the wards, every place in the hospital, so that if you wanted to contact someone, someone in the telephone office would page them, and it would come out as a page. So it wasn't as if you could just do a beeper or call them on the cell telephone. You had to listen for the page. Dr. Jones went to the wall, answered the phone, and came by our table and said, "They've shot Kennedy and they're bringing him here." We were all stunned. My first reaction was, Ron's not right. They didn't shoot Kennedy. And yet, you know, you couldn't not believe him. Dr. Jenkins, being the chief of anesthesia, immediately thought of the need of an anesthetic machine to help, you know, take care of the president. He rushed off to get an anesthetic machine, and Miss Bell, the operating supervisor, and I rushed out a back door of the cafeteria, down one flight of stairs, down the hall, and then into the door of the emergency room. Going down the hall, I had never seen so many people in the hallway. There were just so many people, and far beyond the usual number. And I thought, boy, This is not good. When I walked into the emergency room, the first person that I ran into was Jackie. And she had this lovely pink dress on, and from the waist down, it was covered with blood. And it was kind of nauseous because I suddenly realized that they did shoot the president. Jackie was kind of wandering around. No one was really attending to her. She had disbelief in her eyes, great sorrow. She'd been crying, and you wanted to say something. You wanted to comfort her. Beyond me, I didn't know what to tell her. And I just went past her to go in to trauma room 1, as you see here. Now there's the door. It's a swinging door, and it swings inward and goes against the wall. And it's not too large a room. And there were a lot of people in this little hallway. You go back to the first film scene. In this little hallway, there were so many people that all dressed in suits like I am now. You never see that in this particular part of the emergency room. And against this wall, on this end of the hall, there were many dignitaries just standing, you know, with hands folded. And the only person I really recognized was Earl Cabell, who was the mayor of our city, and ultimately became a senator from this part of the state. And so that was unusual to see that sort of a scene. And when I got in the room, gosh, it was filled with people, and the president was already there. He was on a carriage, and the first thing that struck me was, gosh, he's kind of big, because his ankles extended off the end of the gurney. That's a stretcher that has wheels on it, a gurney. And then his head reached the far end of the room. Now then, this is the appropriate picture. Small, a lot of equipment in the room, and probably 12, 14, 15 doctors in there trying to resuscitate the president. I'm an oral surgeon, and I was authorized or credentialed to enter the room because if he'd had an injury about the face or jaw, then that would have been our domain of instituting emergency care. So I just slowly made my way around behind the people who were resuscitating the president, and Dr. Jenkins was at the head of the table, already hooked up the Anaesthetic Machine to what's called an endotracheal tube. An endotracheal tube is nothing more than a big cannula that goes through the mouth and then down into, well, not in this case, they didn't have to go through the mouth because of the wound that came through the neck of the president. So they just enlarged that wound and were immediately in the trachea, the conduit for air, you know, coming in and out as we breathe. So they'd enlarge that wound and put the endotracheal tube in place, and Dr. Jenkins was doing his best to aerate the patient, give him sufficient amount of oxygen to carry through the body and maintain life. They got the position where I could see the president's face, and it was kind of smudged with blood and caked mucus and things of that sort, but there was no visible wound. And as I went on, you know, I just looked up under Dr. Jenkins' maneuvers and trying to resuscitate him, and took a look at the patient, the president, and he had a large defect, meaning a hole in the back of his head on the right side, a big wound, and about the size of your fist, which is really pretty big. And there was matter coming out of the wound, which would be brain material, and it was collecting on the gurney. And that, to me, was most discouraging. You know, it was all likelihood a lethal wound. But those gathered in the room, Dr. Jenkins, Dr. Baxter, Dr. McClellan, Dr. Clark, Dr. McPerry, they were all dedicated, committed surgeons, neurosurgeons, whatever, committed to saving people regardless of the magnitude of the wound, doing everything possible. And I'm sure most of them realized that it was a futile process, but you don't stop trying to save any individual, and particularly the President of the United States. You know, as a bystander, and that's all I am, is a bystander. I was witness to what was going on. I had nothing to do with the treatment, but it was clear it was out of my domain, and I slowly made my way out of the room. And it wasn't long afterward that they did declare the President dead. He was admitted to Trauma Room 1 at 12:35 p.m. And a little less than 30 minutes later, he was declared later. So even though that small segment of time is short, it seemed forever, you know, just things were just moving in slow motion. And I just left the immediate confines of Trauma Room 1 and went out in the larger area of the emergency room.
Being an observer in Trauma 1 puts you in a very unique position because you're a medical professional, so you know what's being done, but you're not actively participating. And that gives you a unique perspective, simply observing what the doctors are doing in there and being able to really study the President's wounds in detail.
Well, no one really was studying the wounds. They were trying to revive the President. And so there was very little assessment of the wounds being done in the emergency. They're trying to keep him alive. He's dying, if not dead, at the moment he was there. So every effort was made to restore heartbeat, restore circulation of blood, to keep him alive. So there was not much attention given to the wounds. And I just feel kind of fortunate that I was able to look under Dr. Jenkins kind of working the anesthetic bag and see the wound, you know, just under a lot of arms and things of that sort. And it just, you know, I'd seen those before. I don't know anyone who'd survived them. And so it just, from my standpoint, was a futile effort. And yet, you know, regardless of futility, you continue to try to resuscitate.
Mm-hmm. We've all seen emergency rooms depicted on television and in movies. Was there loud shouting and frantic movement? Was there quiet, hushed conversation? What was it sounding like in Trauma 1 when the President was dying?
There was no sound. You know, it just everyone knew what his job was, and so it's a little conversation in Trauma Room 1, but not in the larger area of the emergency room. Everyone was hushed because this was a sorrowful time, a sad part of our city's history just occurring before everyone's eyes. So there wasn't a lot of noise or clamor, but there were far too many people in the emergency room that had no reason to be in there. Security in those days was not great. If a door had a sign on it, "Do not enter," people didn't go in. So we didn't wear even security badges at that time. So people just obeyed signs, behaved themselves reasonably well. So there was just an inordinate number of people, but they were well-behaved people in the emergency room.
Looking from this picture, we're going to look at one that was taken from the same vantage point, just slightly to the right.
Yes.
And you really get a sense of how small this room was. And if you can imagine 12 to 15 doctors in there, I have a hard time imagining that. Can you tell us, Dr. Walker, what some of this equipment is? Do you recognize that?
This is an anesthetic machine, a little bit larger version than the one that Dr. Jenkins had gone and gotten quickly and brought to the emergency room. By the time we got there, they'd already placed this endotracheal tube in the trachea so that they could have movement of air from the machine to the lungs, so that the patient was being aerated. It was hooked up to what's called an automatic ventilator. An automatic ventilator just beats to a certain rhythm to move air in and out. Dr. Jenkins brought the anesthetic machine and moved the ventilator aside so that he could hook up the anesthetic machine to the endotracheal tube and then control the amount of oxygen, which was pure 100% oxygen that was being delivered to the patient. In a small room, that made movement even more difficult. Brought in this larger machine, and it still had the ventilator in there. This happens to be a suction machine. When people bleed excessively or you vomit, you have to have a great vacuum suction to remove large amounts of fluid. And this is one of those of that era, probably a little less sophisticated than the one shown here in 1963, but not much different. So, just a small room. I should mention the names as we go along, because those are our links to things that any of us have to life. Ron Jones, who was the one who answered the page that I told you a few minutes ago, went on and finished his residency and came on the faculty of our medical school and served 2 years as chairman of the Department of Surgery. So Ron became a good friend of mine. At the end of 2 years, and they'd hired another person to head the department, Ron was hired by the Baylor University Medical Center, a very large, prestigious hospital on the east side of town. Ron, to this day, is still chairman of the Department of Surgery. Uniquely, last night, I was working out at a fitness center, and Ron and I were both there. And I forgot to tell him that I was going to mention his name today, so when I get back to the office, I'll have to call and say, Ron, I mentioned your name today.
But Dr. Jones is really one of the rare exceptions, because as you and I were talking earlier, so many of the doctors that treated President Kennedy in Trauma Room 1 are no longer with us.
Yeah, that's correct. The principles involved in that, in the direct care of the patient, are mostly gone. Dr. Jenkins is dead. Dr. Kemp Clark, who's a neurosurgeon and came on the faculty the same day that I did, on July 1, 1956, he is dead. Dr. Clark signed the death certificate because it was a brain injury that caused death. Dr. Paul Peters, whose name I've not yet mentioned, but he was chief of urology, he's dead. Dr. McClellan, who was in the room, is still alive. He's a little bit younger than I am, and probably as good a historian of this event as is alive today. Dr. Mac Perry, who was probably the most diligent surgeon working to revive and resuscitate the patient, is still alive and lives in East Texas. He has his own plane, and he flies back and forth to Dallas once a week to attend Department of Surgery meetings. So it's his link just to stay up. Mac was deeply emotionally affected by the president's death, and he was unable to resuscitate it. So to this day, Mac will rarely say anything about his involvement in the event. Mac's a good golfer. I like to play golf with Mac. He's a great guy. But we sure don't talk about November 22nd, 1963.
I think it's worth pointing out that really you didn't talk much about this subject until just earlier this year.
Really is strange. We were all affected. There was no edict or anything to not talk about it. No one ever told me not to talk about it, but I never did. And in February of this year, well, you know, doctors have to be certified and become a board member to really tell the public that this guy's okay, you know, he's safe for you to operate on him. The American Board of Oral and Maxillofacial Surgery had its examinations here in Dallas in February. And the last night, there was a banquet held in this room, right here. They had a catered affair in this room. And as an old board member and an old president of the board, I was here. And the current president, Dr. Tyner in San Antonio, Texas, just singled me out and says, Dr. Walker's here tonight, and He was president when the Kennedy was shot, and says, "Bob, would you come up here and just tell us what your experience?" Well, you know, that was like a little bit of preparation, but it was easy to talk about because no one has ever forgotten what happened on that day. All of us are intensely aware of exactly where we were, what we were doing, and that sort of thing. Well, the extemporaneous description of my bystander views of that day were heard by attendants here at the museum and relayed the information to Mr. Fagin. And I had an immediate email from Mr. Fagin if I would come down and do a video description of that day. Well, you know, so here, having not talked about it for, like I said, 45 years, since February, I've talked more about it than I ever have in my life.
as usually is the case.
Yeah.
I want to take a look at what was going on outside the emergency room, outside Parkland Hospital. You have here the hearse which brought the casket, which took the president back to Love Field, and you have all these police officers. Were you or any of the other doctors really aware of what was happening outside of the emergency room?
None of us walked out there, but he mentioned something, the hearse. When there is any instant death occurs, which would be what happened to President Kennedy, that would be described as an instant death. There is a law in Texas that requires an autopsy be done at the hospital where he's brought to determine the cause of that death. Well, after Kennedy was declared dead, there was a small confrontation between Earl Rose, who's a doctor of pathology and is in charge of autopsies at our hospital, and with one of the Secret Service people, I think it was Kellerman, about the need to keep Kennedy there to do the autopsy, and they already had the casket and already had Kennedy placed in the casket. And there was no loud language and no physical interface between the two. Rose was trying to adhere to the laws of Texas, and the Secret Service person whose job it is to protect the president, and he died on his watch, was determined to get him back to Washington, D.C. So there was an instant, maybe a minute and a half confrontation between the two. Not any tug of war, but strong will trying to prevail of what was right. Well, the Secret Service person prevailed, so the casket was taken outside and obviously loaded into this hearse and taken to Love Field for his transportation back to Washington. So the autopsy was not done at Parkland Hospital as was required by Texas law, because the will of the Secret Service person was stronger than our pathologist. There was no wimp, I can tell you.
That's become a very controversial point in this story, is the fact that the president didn't receive the autopsy he should have received in Texas, and received a rather superficial autopsy later that evening at Bethesda Naval Center. I want to look at one more picture here from outside of Parkland. This is just after 1 o'clock, when news of the president's death was being announced over car radios, transistor radios, and people were reacting. And I want to ask you about this. As a medical professional, as someone in the trauma room, you know, you're watching these doctors treating the president, you have a job to do, but would it ever occur to stop and think, who's on the table, the identity of this individual, and the historic magnitude of trying to save the life of the President of the United States?
It can hardly enter into your mind. You know who it is. But we're faced with that sort of a situation pretty often, because we've done surgery on friends, and you don't want to think of them as friends because you can only think of the job that you have to do. Because then that begins to say, well, gosh, I better not cut that. That might hurt him. Oh, well, you just can't think in that way. You have to do what has to be done. So even though there's plenty of awareness who was lying on that gurney, that did not affect one way, what had to be done to revive him.
He just has to become any other patient.
He has to become just another patient that got shot and was brought to this emergency room. So he was treated as any other patient. Kennedy had many illnesses, just a multitude of them. One of them was Addison's disease, and that's a problem of the adrenal gland that kind of hooked on or close to the kidneys. And so he has to take steroids throughout life. It's a manageable thing, but during times of stress, you need something called a steroid or cortisone to help, the patient through that period of stress. When Dr. Jim Carrico was a second-year resident in charge of the emergency room, he's called the pit boss. A second-year resident, a surgery resident, and he's the pit boss. When word came to him, he knew that the president had Addison's disease. One of our residents, an oral surgeon, was there visiting with Jim, when that word came. And he instantly told Don Curtis, one of our residents, says, Don, if you'll do a cut down on a vein in his leg to get fluids going, I'll determine his steroid need and get those administered efficiently. Now, cut down means that you make an incision over a big vein in a limb that's far removed where you'll be working, so that you can insert a cannula into that vein and deliver large amounts of fluid. Because when you're shot, you lose a lot of blood. And you have to replace circulating volume to maintain, life. So one of the purposes of a cut down, I usually do it 4 limbs on a massive gunshot wound, both legs, both arms, so you can get massive amounts of fluids in there. You got about almost 6 liters of blood. You know what a liter is? Boy, you get 6 liters, that's a lot of blood. So if you've lost a good portion of that, you have to replace it quickly, or death will come rapidly. So those were little side events that were going on. But the emergency room is geared to do those things, just as they occur.
I want to give you guys a chance to ask Dr. Walker some questions. We have about 15 minutes left. Since we are recording this and I have a microphone, if you'll just raise your hand, ask your question, I'll repeat your question, and then he'll have a chance to answer it. That way we can have the question recorded also. So please raise your hand and we'll get started. Yes, ma'am, you go first.
Were there any doctors who weren't trying to help the president?
Question was, were there any doctors there that weren't trying to help the president?
Probably people like me that have duties to perform if there's an injury to the part that I'm responsible for care in that emergency room. So I had nothing to do with the immediate care, but I had to see where they had an injury about the face of the jaw, and so I made my little tour through the emergency room. There might have been 1 or 2 others that I can't recall. So but all the doctors were aware, all the doctors in the hospital were aware that Kennedy was in the emergency room. So there were probably 1 or 2 others that came through.
Just to sort of see what was going on?
Yeah.
Back there, yes ma'am.
What inspired you to become a medical researcher?
What inspired you to become a medical researcher?
The culture of I never considered myself a researcher when I joined the faculty. And yet the whole culture of our school was determined by one man, Dr. Don Selden, who's the chairman of the Department of Internal Medicine. So he'd done, that was a requirement that they apply for federal grants, everyone engage in research. So everyone who's a full-time faculty member was expected to do research of some kind. So that was suddenly, I had to think of what was a significant problem in my field that I would like to do research on. So I treated that from that requirement to do it.
So it was sort of out of necessity.
Oh, it was necessity. If you were going to survive in that academic life, you were going to have to do research.
I see. Interesting. Yes, ma'am.
You said that no one was talking while they worked on the president. Was there a lot of
The question was, you mentioned earlier that there wasn't very much in the way of communication in the trauma room. Was there a feeling of tension in the air?
There was a feeling of anxiousness. Everyone knew the dire circumstance, but there was no feeling of panic. Everyone was doing his job effectively and efficiently, as one normally would under those circumstances. So there was no, I won't call it tension, but let me tell you, the epinephrine titer was high. Epinephrine drives us to do things under emergency circumstances. And there was one word, or one sentence that was uttered by Kemp Clark, the neurosurgeon who signed the death certificate. And Mac Perry was continuing to try to revive the president, and Kemp said, "Mac, there's nothing more that we can do."
Yes, right there.
As soon as Kennedy arrived at the hospital, were there still doctors attending the other patients?
Well, that's a great question. When the president arrived at the hospital in the emergency room, what happened to the doctors that were treating all the other patients that were there?
It's not a funny, it's a serious problem for emergency room. There are far more people who appear in the emergency room for treatment of something that is not life-threatening. And so the non-life-threatening reasons that a patient is in the emergency room can be put aside for a while that doctor does something that is an urgent need at the moment. There's a term called triage, T-R-I-A-G-E, that nurses do, or did at that time, determine the seriousness of the injury of the patient being brought into the emergency room. So they sorted patients, those that were going to die quickly or imminently if something's not done. The doctors are notified of that, and if they're treating something that can be put off a little while, they'll just have to put that patient aside and move on to the one that needs urgent care. That's a big problem now, and you read about long waits in the emergency room because too many people are coming to the emergency room for things that are not life-threatening.
Interesting. Okay. Over here, yes, ma'am.
What was it like for you when you were leaving the trauma room after you saw Kennedy? Like, what was going through your head? Like, were you scared, nervous?
What was going through your mind as you, having seen the president, walked out of the trauma room?
Pretty numb. I was stunned. I just could not believe that what had happened. And it's hard to describe it as anything else. And it's interesting what the rest of the country and the rest of the world felt toward the city of Dallas, that we were responsible for the shooting of the president. We were responsible for his death. And that was thrust upon us, not immediately, but very shortly thereafter, because I had friends from other parts of the country that called me and said, "Bob, why did y'all kill the president?" We didn't kill the president. That he was shot in our city, and everything possible was done to revive him. So, but my immediate feeling was numbness. Gosh, how could that happen here? And it remained for a good while.
Other young lady over here.
When you first saw President Kennedy on the stretcher, did you think he had much of a chance?
When you saw Kennedy on the gurney, saw the wound in his head, did you immediately know that he had no chance?
That's not for me to judge as an oral surgeon, but I'd seen that wound before, and I knew that it was a significant wound and one from which the president was not likely to survive. That was just an opinion, not having done one thing to the patient, but there was a big hole to be in a head.
Okay. Yes.
Suppose that because technology has evolved today, would the president have been able to be saved today like hadn't even shot at this time instead of
With today's technology, would President Kennedy maybe had a better chance of surviving?
It's an interesting, neat question, but not likely. I mean, we're far along, but we've got nothing to stick in there to replace damaged gray matter brain. So I think his was a lethal wound today, tomorrow, 50 years from now.
Yes, right there.
He stated that there were 12 to 15 doctors inside the room.
Uh-huh.
Were there nurses in there as well?
In addition to the 12 to 15 doctors, were there also nurses squeezed into trauma room 1 also?
Yeah, yes, there were. And I won't say that there were 12 to 15 doctors there constantly, but they were in and out. Mm-hmm. And the nurses were in and out. They had to have instruments that are under the care of the nurses in the emergency room. They know where those are stored. They're all kept sterile, so they're bringing them in and unwrapping them in as sterile a manner as you possibly can. It's impossible to keep everything sterile under the circumstances under which he was being treated. But you keep it as clean as possible. In the event that someone survives, well, you don't want supervening infections to occur. But yes, there were plenty of nurses in and out.
We have time for about 2 more questions. I'll take yours right there, ma'am, and I'll take somebody over here. I'll take you in just a second. I'll come back to you. Yes, go ahead.
Like after you saw Kennedy's wife, not the first time, but have you seen her after she had a dream change?
Had her what changed? Mood. Okay. You saw Mrs. Kennedy, Jackie, in the bloodstained suit. When you saw her later on, was there anything different about her? Had her expression changed or anything like that?
I'm not sure that I saw her again. I don't recall seeing her again. I saw her when I first entered the emergency room, so I don't know where she had been taken. I know that she was brought after the president was declared dead. It's amazing. I mean, everyone disappeared, and there were only 1 or 2 of the physicians still in the room, taking out leads for measuring the heart rate and taking out cannulas put into veins and things of that, kind of cleaned him up. And they brought Jackie back into the room where she most poignantly and sadly, kissed his feet, kissed his thigh, kissed his body, and it's just a sad thing. But I was not witness to that. I just know that it occurred.
Right. And this other question. You, sir.
You said that there was all the doctors and people in there, and why wasn't Kennedy's wife?
The question was, there were so many doctors in trauma room 1, was Mrs. Kennedy in there during the treatment, or if not, why wasn't she in there? Do you have any insight there?
She was not in the room while all the commotion was going on in resuscitation. And it's a little bit of a concession that she was wandering around in the emergency room, because usually families not allowed in the emergency room while a loved one's being managed. Because there's some things that are not gentle to the eye or the emotion that has to be done to a loved one to save her life. Things, incisions across the skin and loss of blood and, holding of tissue apart to get to a bleeding vessel that family should not see. Now then, that philosophy is changing a little. Now then, if families want to be present, there's consideration of the merit to allowing that to happen. I'm not have enough wisdom to know that that's the thing to do or not. But it was a concession for Jackie to be in the emergency room, because if it had been someone else, they'd have been in a waiting room someplace.
I see. Interesting. Well, that's all the time we have today. Would you please join me in thanking Dr. Walker for taking his time to come here and talk to us?
Let me say one final thing. I appreciate the kind introduction that was done by the young lady a few minutes ago. That was very well done, and I appreciate it. And I appreciate the interest that all of you have in some part of our history. You know, we like to establish links to things that have happened before us. And you're not the only one seeking that, because I have done that in my life, trying to establish links between myself and well-known surgeons in the past. I've talked to people who knew the person, who knew what he was like, and I've always felt that that was my tie to that individual. You have a tie to something that's pretty significant in the history of our country right now, the death of a president. I'm your link to the death of Kennedy. I take no cheer or joy in that sort of statement. But we need those sort of things to understand that they did happen. There were people present. So you have something that's unique that not many youngsters in this country will have. Thank you very much.
Absolutely. I agree wholeheartedly. You're fine.
On behalf of Education in Action, we would like to thank Dr. Walker for telling us his side of the story.
All right. Thank you.
Excellent.
Thank you. Oh, well, thank you. Shake my hand.